Let's take a look at cancer. This data was released by the Ministry of Health, Labor and Welfare. 1 in 3 people in Japan die from cancer. The mortality rate has been going up every year. The number of cases of cancer has been soaring, and it has been ranked the highest cause of death from 1981 to present. Every year, 650,000 people are diagnosed with cancer. At this rate, anyone can develop cancer, even people who are close to you. What can we do to prevent cancer? Let's take a look at the mechanism for cancer development. As a matter of fact, even healthy people develop 1,000 cancer cells every day. However, they do not develop cancer because the fighters inside the body, called immunocells, are eliminating the cancer cells. Please take a look at this picture. It shows one type of immunocells eating up cancer cells. This picture shows one type of immunocells destroying cancer cells. As one can see, immunocells are eliminating cancer cells every day. When people are healthy, the immunocells are stronger than the cancer cells, and when they develop cancer, it is because the cancer cells are stronger than the immunocells. If there is even one cancer cell left that was not eliminated, it will double its number by 2, then 4, then 8, and keep on increasing. Please take a look at this graph. It shows the number of cancer cells and the elapsed time. The cancer cells that were mentioned before have continued to divide and multiply. When they reached about the 30th division, they can be recognized as cancer for the first time by diagnostic imaging. At this point, the cancer is about 0.7 centimeters in size. The normal size for early cancer detection is about 1 centimeter in size, 1 gram in weight, and 1 billion cancer cells in number. The elapsed time until this detection is about 10 years. From here on, it is scary. The time it takes to go from progressing cancer to terminal cancer is only about 3 years. This means that when the cancer is detected after a prolonged incubation period of 10 years, it must be treated within a window of 3 years. Do you know the 3 main treatments for cancer? They are considered the standard treatment procedures for people with cancer. Surgery is performed for the early stages of cancer and is the most effective treatment for the primary tumor only. However, surgeries have limitations if the cancer is located in an area that is difficult to operate on, or if the cancer has spread elsewhere in the body. Also, surgery can damage healthy parts and significantly lower the patient's immunity. What about the radiation treatment? It is easier on the body because it does not necessitate surgery and is effective for brain tumors and bone metastasis. However, when radiation passes through, it also destroys the healthy cells and causes adverse effects. Although patients must pay the entire treatment cost, there is treatment available with less adverse effects. What about chemotherapy and anti-cancer drug treatment? Both show a significant amount of effectiveness for blood cancers such as leukemia. However, they also kill healthy cells and cause severe adverse effects and a great amount of pain and suffering. Also, if the same anti-cancer drug is used continuously, people develop a drug resistance and the medication will not be effective at all. Cancer cannot be completely cured with the current standard treatments, whose effectiveness is only about 30%. The treatment that has been getting the most attention recently is the so-called fourth treatment, immunocell therapy. In this treatment, the immunocells that already exist in the body are cultivated and strengthened in a lab and then returned back to the body. This treatment has small adverse effects and is easy on the body. However, the existing immunocell treatment is not very effective for shrinking the cancer, and there are only 2 out of 10 people that showed life-prolonging effects. On the other hand, the treatment that shows significant effect compared to the existing treatment is the cancer treatment called Immunocell Bach therapy. Let me introduce the Immunocell Bach therapy. The recognition method for cancer cells is different from other immunocell treatments. There are no adverse effects. The patented technology increases the immunocells to 10 billion in number. This treatment has proven a significantly larger percentage of effectiveness at 76%. There is a main difference between the Immunocell Bach therapy and the common immunocell treatment. It is the way it recognizes the cancer cells. Let's take a look inside the cells. In the common immunocell treatment, the immunocells that are responsible for recognizing cancer will look for 2 markers, cancer antigen and leukocyte antigen. If they can recognize these signs, they will eliminate the cancer cells. This mechanism is extremely easy to understand, and highly effective treatment results can be expected. However, something terrible happens. As the cancer progresses, about 70% of the cancer cells will hide one of the markers. This is one of the reasons the common immunocell treatment is not very effective. What about the Immunocell Bach therapy? It detects the healthy cells instead. By recognizing the healthy cells, Bach immunocells will attack the unhealthy cells, in other words, cancer cells. Even when the shape of the marker is different or hidden, they can still attack the cancer cells. Also, there is no worry for adverse effects because they will not attack the healthy cells by mistake. Also, the fact that there are 10 billion cultivated immunocells and the strong activation technology is patented prove that this treatment has superior effectiveness as compared to other immune cell treatments. Let's verify the actual data for the patients who received this treatment. 230 patients who are receiving the Immunocell Bach therapy have less than 96 alpha-1 Ag, which is a marker for measuring immunity, and have stage 3 and 4 fast-growing cancer. The life-prolonging effects are dramatically longer at 37 months, over 3 years, and this data is pertinent for every patient. Next, 93 patients who are receiving the treatment have over 96 alpha-1 Ag and have stage 3 and 4 fast-growing terminal cancer. However, we cannot expect too much effectiveness from the Immunocell Bach therapy treatment for those patients. The life-prolonging effect is only 5.5 months. Although the effect is small, 93 people still receive this treatment because it has a pain-relieving effect and increases the quality of life. Here is the detailed data for the 230 patients who have less than 96 alpha-1 Ag that we mentioned previously. It shows the average prolonged life in months for all patients. Even when the patient has terminal cancer or metastasis, we can expect the high life-prolonging effect and an improved quality of life if they are treated while they still are maintaining their own immune capacity. Also, there is another main unique characteristic. It is cancer prevention. For example, why is it that the cancer comes back often even after it is removed by surgery? It returns because there are invisible cancer cells left, and this allows the cancer to grow back. Immunicell Bach therapy cultivates and strengthens the immunocells that already exist in the body, so it is possible to eliminate small cancer that is invisible. If the cancer is under 1 centimeter, it can be eliminated completely. Let's take a look at the data. 25 patients are receiving the Bach therapy for after-surgery cancer prevention. The result shows that there are 0 patients with recurrent cancer. Every patient is still alive, and the life-prolonging effect so far is 76.6 months and continues. In general, if there is no recurrence or metastasis after 7 years, the patient is declared cancer-free. From this data, it shows that this treatment is extremely effective cancer prevention, not only for patients after surgery, but also for healthy people. Please take a look at the letter of patent, the trademark registration certificate, and the cancer prevention certificate for the Bach therapy.